So I get this question frequently is, who should I see first? Should I see my doctor? Should I go to the orthopedist? Should I go to the physical therapist? Should I come see you as the chiropractor or my regular chiropractor? Or should I go and work with my strength coach on some things? And depending on what your problem is, the answer could be any of those things. What I would like to explain today is kind of where my skill set specific to me fits in on this continuum, and that's how I like to view it. So if we have one end of the continuum, we might have the orthopedic surgeon, and then on the other end of the continuum, we might have the strength coach, the golf coach, the endurance training coach, or some version of that. So those are kind of the extremes, and then oftentimes a person like myself with my skill set kind of straddles big chunks of the middle, right? You might need to have your labrum repaired or a meniscus cleaned up or something like that. And in my office, oftentimes we can diagnose those things. Maybe you come in and you have a swollen knee and we need to take a look at it. And sometimes I can save you a little bit of money by shortcutting going in to see the orthopedist. They're like, yep, this needs an MRI. And then we've got to send you out for an MRI, and there's lots of wasted time and trying to get on the schedule. Then on the flip side of things, maybe you're working with your coach and you're not getting any type of improvement. You've been stretching, you've been foam rolling, but your knee is still swollen, your back still hurts. So oftentimes I kind of play that bridge or that gap between primary care and or orthopedic all the way over to your coach, right? And so I'm able to speak both languages. When you come into my office, I can oftentimes tell you, hey, this needs an x-ray, or hey, this needs an MRI, or hey, I'm glad you're here, this is a perfect fit. Most of my clients don't get referred out, thankfully, because most people just don't need more aggressive or invasive procedures or surgeries. And then oftentimes we're able to shuttle you back or even just keep you training as opposed to completely taking your time off from working with your coach. My job when you come in to see me is to communicate with both ends of these spectrums when it's necessary. And then oftentimes I understand both sides of those spectrums, so I can be that bridge, I can be that gap, I can be that liaison between the two sides. So if you're not exactly sure where you fit in this world, if you're not, you can always reach out. If you need a quick consult, if you got a few questions, send them my way. I'm happy to help, and then we can figure out, are you a good fit for the skills that I have, soft tissue rehab and conservative care? Or do we need a little tweak in our programming? Or do we need to go see the orthopedic and have a steroid shot? Or maybe we need a blend of some of those things. I'm happy to help. So just let me know if you have any questions, and be well. Looking forward to hear from you.